Even with help on the way, the COVID surge is not stopping, especially not in Virginia. With 4,000 new coronavirus cases in that state Sunday, they are on week 2 of Pfizer vaccinations, expecting the Moderna shipments today. But even as that rollout is starting, the Trump administration is saying it might not happen as fast as was originally promised, with Virginia maybe seeing a 25% reduction in vaccine shipments in the coming weeks. I want to bring in NBC News' Vaughn Hilliard, who is joining us now live from Norfolk. Vaughn, what is the reason for this, and what is the frustration level there to this news, especially, I would imagine, among healthcare workers?
Exactly, Hallie, and this is the case in more than a dozen states. Let's just use Virginia as an example, and the healthcare workers that are eagerly awaiting these vaccines. Sentara Healthcare runs this major hospital here in Norfolk, as well as 11 other facilities across the greater area. They have 30,000 employees, but so far they have just 11,700 Pfizer vaccines. And so that's why the news over the weekend from the state of Virginia Health Department that they would actually be receiving 25% less vaccines by the end of the year than originally anticipated leaves a lot of question marks up in the air. But this is going from California, Iowa, Montana, Michigan, Nevada, California. Just take a look at a tweet here from Governor Jay Inslee from the state of Washington, in which he said, quote, "This is disruptive and frustrating. We need accurate, predictable numbers to plan and ensure on-the-ground success. No explanation was given." Pfizer said in a statement that it has had no production issues, and we should note, over the weekend, it was actually the chief operating officer of Operation Warp Speed who apologized, saying that this was an error on their front and a misunderstanding of the exactness in which it takes for these vaccines, every one of these shipments, to be rolled out. And it came down to essentially a couple days in which the FDA has to provide a certificate of analysis for every shipment that goes out. And that has caused a lag in the rollout of the vaccines. Why Pfizer said they have the vaccines available, but it is the federal government's obligation to ultimately provide that certificate of analysis for each shipment that does go out. So there is that little bit of a lag period. But that's why the other big news of the day, not only here in Virginia, at this hospital, in fact, but around the country, is that these Moderna vaccines are coming in. And a hospital official here tells me they don't know exactly what time it's coming in. They're hoping today. They don't know exactly how many vaccines they're getting, but they're just anticipating this because, as I said, they only have vaccines for about a third of their hospital employees at this point in time, Hallie.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.